Thank you for hitting play, and welcome to the series we're calling Data Pioneers. We're bringing together the brightest minds in the healthcare industry, supporting the transition to value-based care. We'll be highlighting the best practices, tools, lessons, and advice with a focus on data and analytics. I'm your host, Rich Waller from WellStack, and we're very excited to have you join us today. Stephanie, welcome to Data Pioneers. It's great to have you. It's always great to connect.
Yeah, I'm excited to be here.
Awesome. Well, as we discussed, we've got Stephanie Lahr here, currently with Vital Thread Consulting, and we've had some great experiences over the years with Stephanie, and we just couldn't be happier to have her on with us today. We're going to be talking about a lot of topics, kind of a whole approach to maybe how we think about redesigning healthcare, some of the latest topics around technology and data. So I think we'll just dive right in. It's great to have you. I think it's so interesting when I get to spend time with someone like yourself that comes from a background that, you've been a physician, you've been an informaticist, a CIO, now a founder. Your perspective is so valuable, but yet so unique. And, I think, as a way to start off, it would be interesting to just, kind of think about how we, and the way that you say this is, kind of transitioning from making healthcare suck less and, bringing joy back to healthcare. And so, what do you see driving the shift? Like, what are you passionate about that's happening right now in the industry?
Yeah, so maybe a little context there. Early in my career as a CMIO, I was heavily involved in, EHR optimization. That was the primary tool, right, that we all had. And they were foundational, they were required, it was essential to the work that now we're able to do to layer on top of that. But it was never really designed with the clinical workflow in mind. It was designed to achieve a number of different goals and capture information and data. But really, with the idea of converting from paper to something digital without a reassessment of what opportunity that might present. And again, without really thinking about how that would fit into workflow. And so in my career early on, I would joke that, the best I could do if I was going to put a billboard up that was anything authentic would be like, I can make it suck less, vote for me for your CMIO because I can make it suck less. And that was good. We needed that work to be done. But I think what's super exciting about where we've come in just the last couple of years and are on this massively accelerating road is that it doesn't have to suck at all anymore. And I think that, the technology is capable now of really removing the friction. And I know we'll talk more about, what does automation and smart hospitals and what does that look like? But I think it's really bringing advanced technologies that we can layer into workflow that can make everything better and meet clinicians and operators where they are and where they work best, and allow the transactional and administrative things to sort of fade into the background. And so it's a really exciting time to see where things can go, knowing that the technology has caught up with what we need it to do.
And given that you've been in both roles of sort of the clinician, physician and technologist, what advice do you have for, kind of both sides of like how to best, come together at this time? I mean, like I'm a technologist, as you know, I've never spent any time in a clinical setting, but I spent a lot of my time like really trying to connect, learn about, how workflows really work versus just kind of what happens in the lab. What models have you seen, or what advice do you have for those of us that are out there kind of trying to build solutions to connect with, the clinical and administrative side of the industry?
Yeah, I think right now partnership, and partnership is a word that's starting to become a bit of a buzz and overused word, but really partnership is going to be essential. I think that technologists understand deeply the technology, what it's capable of, what its limitations are, the incremental elements that need to be put in place in order to move things forward, the processes and elements that can't be jumped over. Um, and of course, the healthcare delivery people, operators, clinicians, etc., they know care delivery, and bringing those pieces together is how we're going to move farthest, fastest. And so my recommendation and the work that I do with any number of the companies that I've worked with in the industry is to find organizations, health system organizations, and depending on the tool that you're thinking about, that might look a little bit different about who that is and who that right one is going to be. But it's coming together and almost thinking about co-creation, and co-development, because again, the tech is only going to be as good as it can be utilized in real settings, and you can't there's no substitute for truly being able to be a part of that. And therefore, health systems also need to take an approach of sort of opening up opening up to the idea that working with vendors is not transactional, and really probably shouldn't be thought about as, oh, you have a technology, I'm just going to adopt it as is and we're going to move on. But that you look at a vendor for their ability to grow with you, for their potential, and the likelihood that they can meet you to an extent where you are, but grow with you over time. And then what you can produce together will be better than what either of you could do on your own.
Yeah, absolutely. And I think a lot of those kind of innovative workshop sessions can be, first of all, a lot of fun. I love those types of sessions. And then, if we do come together and have even someone like yourself that helps to kind of really, make sure that both sides are focused on moving that ball forward. We've seen it work really, really well. So it's an exciting time, as you mentioned, for that type of collaboration. And as we think about the future, I mean, you've been kind of on the front lines and a really big part of designing or even kind of shaping what a smart hospital of the future can be. And so maybe you can walk us through kind of the core idea. Kind of first off, like how do you define a smart hospital, and then what are the key components to making it successful?
Yeah, I think as we think about a smart hospital or smart healthcare, right? Because it obviously needs to go beyond the walls of a hospital, although a hospital being the most complex environment that we work in is certainly the place where we can see the most initial value. It's about almost bringing the building, the infrastructure to life, and using sensors, AI, automation to create a nervous system which allows for sensing, interpreting, and acting when appropriate, um, in a way that supports what the humans are trying to do and allows the humans to focus on the elements that a human truly needs to focus on, while the other elements that can create friction sort of fade into the background. And so you can support safety, efficiency, all of those kinds of things by again having this sort of ambient sensor network of various tools that create an ability to garner insights and complete tasks. And so maybe a couple of examples of what that looks like. Certainly we're starting to see that as we think about ambient documentation and being able to listen in a room and take real conversations and then turn them into documents. Computer vision, we're certainly seeing making its way into healthcare and being able to sort of see what's happening in a room, whether that's a patient room or a supply closet or whatever that might look like, even to things, like smart HVAC systems and, heating and cooling for medications, things that right now there might be a person who once a day needs to check temperatures and write them down. Why are we having humans do that? We have technology that should be capable of that, and then technology that can alert us when those things aren't working. And so it's really thinking about, again, how to almost bring the building itself to life and have it support the work that humans are doing. And my favorite example, I've done a lot of process improvement during my career, both as a clinician and then as a health system leader. Right, there's always opportunities to improve various elements of care delivery, and process improvement typically begins with a person who is an expert in process improvement engineering almost coming in, right, coming into a room and observing and noting all the different kinds of things that might be happening, some of which might be relevant to the problem that needs to be solved, and some of it not necessarily, but we can't really tell at the beginning. And so we capture a bunch of information and we then go in and deep dive and evaluate, well, where could this process have been improved, and how do we map it all out? Imagine if we get to a point where sensor devices in hospitals were capable of capturing a lot of that information previously inaccessible, and bringing it forward and being able to deliver and helping us synthesize that. It's kind of like having a process improvement engineer in every room across a health system or hospital all the time, capturing information that you may not even know you're going to need in order to be able to make improvements down the road.
And when you think about bringing what is often not necessarily always a new building or a new thing to life, I mean, what are there infrastructure, barriers or other types of barriers to kind of getting that technology to be pervasive within the walls of a hospital?
Yeah, I mean, at this point, it remains extremely expensive to do. And networking infrastructure is a major element that is going to be at the core of this. And networking infrastructure is expensive. Hospitals that were built in the 70s, 80s, 90s, even early 2000s were not built with the idea in mind of the amount of even cabling and then heating and cooling that is needed to support the network infrastructure. And so hospitals and health systems are really having to think about how to bring those pieces in, thinking creatively. There's some companies that I do work with that are bringing cellular into that environment, so that it doesn't have to require some of the cabling. And there are going to be certain workflows that is very viable for, others that are not. So we're going to have to be creative in how we think about that. But the other thing is, the vendors that are going to deliver into this space really, really have to focus on delivering a high quality, high value ROI, and not necessarily in a traditional financial way, but they've got to show value quickly, because the amount of money that it is going to take to build out the supporting infrastructure to get to these levels it is significant, and is going to, there are going to be health systems that are going to really have to make difficult decisions about when and how they make those investments. And so then I think a little bit of it is figuring out how you sort of incrementally work your way into some of that. But again, most of the early focus is going to be on something that delivers a return.
I think we share the I guess excitement and interest in how data collection, starts to, kind of how some of these technologies improve data collection and therefore changes not only the approach to analyzing data, but even the value in many cases. And so I'd love, what are you seeing in terms of, whether it's ambient data capture or other types of data capture that, you're excited about, that you're seeing kind of moving the needle on how we collect data and how that might actually change a lot of how we view even the EHR.
Yeah, I mean, I think it's been interesting over the last few years as we have seen this acceleration of, and the enthusiasm around AI. We all know that AI is foundationally rooted in massive amounts of data analysis that then, can produce recommendations, results, synthesis, etc. The interesting thing is that, and health systems, no one's more aware of this than health systems who have massive volumes of data, much of which they either don't feel is accessible or is has the level of accuracy that they want it to have. And so it's been interesting because, people are so excited about AI and we can predict all of these things, but the reality is no analytics tool is capable of fixing flawed data inputs.
Mm-hmm.
And so if, and obviously there's the old saying that everybody says, oh, garbage in, garbage out. Yeah. I mean, yes, it's true. Um, but then how do we fix that? Right. And I think that is where, when I think about smart hospitals and this ability to, create this sensor network that allows clinicians and operators to do the work that they need to do and to passively understand and capture then that work, we now then have the ability to have accurate, at the point of care, collected information, which then can be immediately leveraged
Yeah.
and will have the highest fidelity possible. And so I I'm all on the artificial intelligence bandwagon for sure. But I think one of the sort of quietly missed concepts at the moment is, while we're all talking about all that AI can do to make these predictions and help move things forward, we also need to really be focusing on how various forms of artificial intelligence can help us capture data so that we've got really solid information to build predictions and other things off of in the future.
Sure.
Because the reality is, humans are bad at data collection. All humans, clinicians or otherwise. So it's just, we're not designed for it. And clinicians especially don't want to do it because it's not part of it, just doesn't fit well into the workflow. And so I'll spend an hour, explaining something to a patient, but I don't really want to have to go back and spend another 35 minutes re-articulating that conversation into, a documentation system. So again, with ambient, we're starting to see that. And I think as we see greater sophistication and deployment of other kinds of sensors, computer vision, RTLS, ultra wideband, those kinds of things that can know where things are, sense movement, see what's happening, understand the nuances of what those things are as we teach it to do those things, then we can passively record high quality data, and a lot more of it than we've ever been able to do by doing it on the backs of humans.
And I think it actually even creates like a completely different backbone for applications and product development. If you think about it, right? I mean, the EHR has sort of become, in many respects, the center of the universe for everyone to build on top of, right? Whether you have a clinical product or you have a technology product that kind of sits in and around and integrates data in and out of an EHR, with these additional data sources that are like to your point, even higher fidelity in many cases and very real time in terms of access. I wonder if there's kind of a next phase of how we develop products and solutions that are on top of that, side, that core source of or system of record, and then how that kind of changes the center of gravity around the EHR and the industry. I think there's some interesting thinking going on right there right now.
Yeah, I mean, I think the next several years are going to be fun to watch. And I think that there is, I mean, no one can argue that the EHRs are foundational to the work that we're all doing. It's going to be the ultimate source where it's the repository of the record. It's going to be the element that drives billing. And it's going to be a foundational piece. But to your point, I think there is a huge opportunity for elements that layer on top of that, especially when we think about some of the workflows that are not dependent in real time on being in the use of that interface, right? And so we can start to think about, what workflows, for example, I talk to people, case managers spend some of their time in an EHR. They spend other time in other source systems, in other care management tools, right? So there's the clinician's work, which is probably going to stay centered in the EHR with tools that hopefully, I mean, maybe this will date me a little bit, but I always wanted to be the Beverly Crusher, right? Like I wanted to be able to say, computer, tell me this, What do I need to know about this? Where are we going with that? I'm thinking about this as a, as a diagnosis. What do you think? I'm thinking about this as the treatment to help me figure this out. And I want to be able to do that hands free in any, kind of in the experience in real time. I think we can do that. The EHR for the clinician will be at the center of that, but we will support it with ambient technologies. But there's a whole other host of workflows and people that are involved in the process, where the work that they're doing doesn't center in the EHR, and they need information from it. And now we can figure out how to bring those pieces together. I think it's a super exciting time. And then the other thing that's really exciting is the advances in artificial intelligence are also support evolution of software development,
Mm-hmm.
right? So it's not just the ability for us to bring those tools into healthcare, but it also democratizes the ability for smart people who may not have a technical background to at least pilot out an idea. And I mean, I talk to, in my work now, clinicians who are ready to be entrepreneurs, who have great ideas, and they can at least, I mean, maybe it's not going to be the tool that goes into the market and is fully scalable, but the fact that they can bring those pieces to life in a small way and then partner with a technology company that may be able to put the bones beneath it to really help it scale is also super, super exciting.
Absolutely. Yeah. There, I mean, that's arguably one of the biggest accelerators right now, is just bringing ideas to life in a way. And I think that there's a lot of, we're going to see, this year is going to be, I think, a huge accelerator in that regard. So we're excited to see how those things evolve for sure.
Yeah,
Um,
agree.
and in terms of when you think about integration into the workflow and the friction, I mean, that's for a technologist, that's like the big thing, right? I mean, there's so many great ideas, especially in healthcare, around how to fix everything from reimbursement to workflows. I mean, we could all sit and have great ideas, but when it comes to like integrating it into the workflow, there's often friction, and then how you attribute ROI. What are you seeing as making the what are you seeing that's successful in terms of tying those things together and really driving ROI within real workflow settings?
Yeah, I mean, ROI requires adoption
Mm-hmm.
first and foremost, right? So the best tool ever will never drive an ROI if people don't use it. And it's interesting because, I think there's been a significant evolution in a very positive way, that people do think about usability, friction, and workflow, but it actually has only very recently come to the center of attention. What used to be thought about in software development and tool deployment was the outcome.
Mm-hmm.
What am I trying to improve? What's the ROI I'm trying to achieve? Right. And then we took that and we backed our way into, okay, how do I need to build it in order to achieve that? And what we're seeing now, after failed attempts with that, were really great technologies conceptually, failed in practice because they didn't fully appreciate and weren't adopted because they didn't fully appreciate the workflow. We're now seeing that change. And while there's this concept of, okay, there's an ROI that we're striving toward, if we think about first the friction, what's the problem you're trying to solve, and what are the potential friction points, and what's the current workflow? I'm the first to say there's opportunity for us to change workflow as well,
Mm-hmm.
right? There's conversations, for example, happening in nursing today around flow sheets. Do they have a place in our future? Nursing leaders are going to have to come together, and they are coming together and having those conversations and trying to figure out if some of those tools that they've used, for decades in their careers, do they have a place in the future? And if they don't, then what do we replace them with, and how does that modify the workflow? So it's not that the workflow can't or shouldn't change as well, but when there's been little attention paid to that or appreciation for that, and we sort of try and reverse engineer into the workflow, then we see those challenges. And so what I would say I've seen recently, after some, again, failed attempts by, in some cases, very high profile companies with strong investment backing and had all the right things, and then it just didn't work, is that people are saying, yeah, if we don't keep the end user in mind from the beginning and think through what is the impact to their work, how does that change, how do we engage them in this, then and ensure usability and reduce their friction, then we're not gonna see adoption. And I think a great example of that, where we saw it work well, was in ambient documentation. Right. I mean, not to say that there's not a little bit of a learning curve in doing ambient documentation. There is, because some of the things that you historically might not have said in front of a patient or to a patient, because they were sort of in your mental processing. And this is, specifically on the physician documentation, ambient documentation side, but also nursing is grappling with some of this right now as well, is you might have to change your workflow and say some things in front of the patient that you didn't say before. And so how do you work those things in, and how do we get comfortable with that, and then allow that to drive the documentation? Because obviously if you didn't say it at all, then there's no opportunity for it to come into the record. So that being said, what ambient documentation did do right, and why we've seen massive, super accelerated adoption, and growth in the space as far as the technology companies who are moving into it, is they all started with the clinician in mind and said, this is their burden, and what can we do to support that continues to support all these other elements, right? The ROI is there. If the notes are done, yeah, and they're accurate and they're billable and codable and out the doorable, then their revenue back into the health systemable, right? And I am guilty myself of sitting in a medical records department or in an office 3 weeks after a patient has left the hospital, completing some documentation. That's not in anyone's best interest. Yeah. But it was just, it was a consequence of the way things were built. So ambient documentation coming in and appreciating and having the mind on the ROI, but knowing if they could solve the problem for the clinician in the immediate, one of the biggest burdens they have, which is going out and writing their notes, it was a win-win. And it's traveled like fire.
Yeah, absolutely. That's fascinating. And I think that it comes back, it feels obvious, but, having the physician and their burden as center, center of focus is absolutely key. And I think that translates to, whatever core persona that you're solving a problem for, like really being able to understand what it's like in the room, in reality, in the process is hard to do. I mean, because they're all busy, they're all, it's difficult to get in and really observe. And I think that's like having that, consultative, part of your team that's either been there and done that, or have that connection to be able to really do that fast iterative innovation cycles are critical. So I absolutely agree. Let's talk a little bit about the work you're doing at Vital Thread. I'm interested in what innovations, investment areas are getting you excited right now in the work that you're doing.
Yeah, so it's been a wild ride it's been actually, I think, like 7, maybe 8 months now. And what I love is that there's so much creativity, so much passion out there, and people who really, want to make change. So it's been fun to get involved with companies of all different sizes. I mean, I have some that are, pre-commercial, some that are, getting ready to raise seed or even pre-seed, to companies that have been around for 20 years and have great products, but are pushing themselves to do more with them. As I look at the full spectrum of all of those, sort of different kinds of companies doing different things, that the things I would say are exciting and getting the most attention are some of the things we've already talked about, things that drive automation, reduce friction, and bring greater insights into health systems that are craving an ability to make things more efficient, deliver a higher level of care, and do it for a lower cost. And then I think the other thing we're seeing a lot is this idea of, sort of the platform approach, where a point solution just can't, no health system is capable of solving the multitude of problems that they have with a singular point solution. And while there will be some point solutions that survive, and there are certain things like, diagnostic equipment and tools are, pointed, but when it comes to, leveraging software specifically, having a core problem that can be solved with an ability to extrapolate beyond and go to the next thing, I think is really important, and what I'm seeing makes some of the difference between companies that are getting traction, getting funding, and companies that aren't. And that, even from the standpoint of a health system being willing to take on a pilot, if all you can do is do one single thing, the lift for them is probably just too high. So it's, how do you bring, automation, reduced friction, workflow improvement, to life, and solve a problem, while also creating a vision for an iterative process of continuing to solve problems leveraging the same kind of technology.
Yeah, that makes sense. And for healthcare leaders that are looking to move sort of that next phase of digital transformation in the industry, what sort of assumptions do they need to adhere to or let go of in order to really move forward in this time, to move quickly, or kind of with the pace of the industry? I think that's something we hear a lot, is like, how do we move with the industry? We don't want to be too far ahead, but we don't want to fall behind in terms of adopting and kind of moving to this next phase of transformation.
Yeah, I think, we saw significant transformation with the era of the EHR. And that was a sort of big bang, massive project. At most organizations, the title of the project itself was usually something like transformation, whatever, whatever, right? In some fancy kind of way to get everybody excited about, this is going to change who we are inherently as an organization. I don't think it's going to be as bold and big as that as we move forward, which seems a little counterintuitive because the technology now is so bold and exciting. But I think we're at a place where transformation is going to be incremental, and very thoughtful, but also specifically targeted, right? And so I think leaders shouldn't be looking for the next massive thing that they're going to spend, millions of dollars, if not hundreds of millions of dollars on, to then take this next chunk of transformation to the next level. I think it's going to be some small iterative things, and I think it's going to be driven a lot by the areas that are looking to transform. Nursing is going to transform nursing, and it's going to be supported by technology. Physicians are going to transform the care delivery that they provide, and it's going to be supported by technology. And so I think it's a way really thinking through, not that there's some one big thing to be looking out for, but that there's probably going to be some key smaller things that are incremental in the transition, and therefore to be aware of what those might be so you don't miss them. And then the other thing I think is exciting to say, and maybe is already well established, I don't know, but from I think for a long time clinicians had this reputation of, we don't want technology. We just, we're technology averse. That's not the case at all. The nurses, the doctors, the therapists, all the clinical people that I talk to are hungry for technology that supports them in the work that they were trained to do. And so, and in fact, I get challenged by some of them more than anybody else, right? They've got great ideas and they know the problems that they want solved. And now it's more about like, well, why can't that tech do this? And when can you make it do that? And that's an exciting thing to an exciting place to be. And so now it's to the point that we're talking about earlier. How do you leverage those people, bring them into the fold? And it doesn't have to be in a super formal way. Many of them are willing and excited to share the work that they're doing with you so that you can improve it.
That's amazing. So I'm curious. One of the things I wanted to learn from today, and I know a lot of folks that probably will listen to this will be interested in, and it's for someone like with your background that has background in as a clinician, as a technologist. What is Stephanie Lahr reading right now? Like, how do you stay current on the in industry? What would you recommend in terms of ways to kind of stay current, up to date, learn new things?
Yeah, this is hard. I actually use some, chat GPT-esque kinds of tools to synthesize some of what's out there, asking it a couple of times a week, hey, what did I miss? Tell me what's happening. I've curated a handful of, of different publications or, podcasts and things, but in some ways I just sort of ask it. I think that there's a handful of headlining kinds of things that have been out there a long time that just good to keep an eye on. Modern healthcare, bigger than just health technology, but what's happening in healthcare overarchingly. The reading I like to do is more about pushing the envelope and maybe sometimes not even really about healthcare specifically. One of my favorite books, and it's something that I just started rereading again recently, which I'm a big fan of a reread, especially if a couple of years have gone by, is the book Upstream.
Mm.
I think that we're at a place now where we need more upstream thinking rather than getting bogged down in the problems that are dragging us back in the here and now. Some number of us need to be focused further upstream so that we can prevent some of the things that are bogging down in the middle. The story that's at the beginning of it is an old fable about a couple of kids that are in a river drowning, and two people are standing on the side of the river, and they run down and they grab them out, and they're like, oh, phew, man, good thing we were here on this riverbank to be able to get these kids out of the water. 2 minutes later, a couple more kids in the river. And so they run back in, get these kids out of the river. They do this 3 or 4 times. And then one of them just takes off running. And the other guy is like, well, wait, where are you going? Like, I need you here where I'm expect there's going to be more kids. We're going to have to get them out. He's like, well, I'm going upstream to figure out who's throwing these kids in the water. Like, let's fix the actual problem, not, put a bunch of Band-Aid solutions on. And I think it's really easy to get mired down in, because that is an urgent and emergent problem that needs to be dealt with. But we have to be thinking upstream to make real transformational change. And I would say, as leaders, finding a balance between doing both of those things, being in both of those places at once, is really, really powerful. So if you haven't read that book, I would put it on your list.
Absolutely amazing. Stephanie, it's always such a pleasure to connect. This was awesome. I really appreciate you taking the time, and hope to see you soon.
Yes, looking forward to it. Take care.
Yeah.